Let's talk about embolization and radiosurgery. This is a little bit of a controversial topic. Some folks suggest that embolization and radiosurgery ought not go together. We tend to use it pretty liberally. Radiosurgery in general, I think, is a very good option for many lesions. Non-invasive outpatient patient has a reasonable rate of cure if they're a relatively low-risk lesion, 80% obliteration rates for lesions that are less than 10 cc's. Hard to beat that, either with surgery or with glue. And then the risks are relatively modest. 3% risk of radiation injury, delayed cyst formation. There have been reports of gliomas or other neoplasms, but again, that's pretty rare. And then the downside, of course, is that 2 to 3 year lag time. Often, even if radiosurgery fails, folks will subject the patient to a second round before going on with something more invasive. Obviously, that's center dependent, but that time lag is real. Okay. Predictors of success. Here's a useful handy-dandy equation for you guys, but essentially, the AVM volume correlates with success, patient age correlates with success, and the lesion location correlates with success. So younger patients, smaller volumes, more superficial location is going to portend a better outcome. Perhaps no surprise there. Large AVMs, this is one that we looked at UCSF where you do volume staging of the AVM where you kind of break it down into more manageable, smaller volume targets, and you independently target those and treat those separately. But the effect is quite substantial, and you can actually have very good outcomes with that. Okay, things change over time, right? So planning has improved, neuroangiography has improved, our tools have improved, and so this is a moving target, no doubt. So I think that this is something that is going to continue. This is a story that's going to continue to be written, and that people are going to continue to argue about. But the truth is, I think all of these techniques have a place in our armamentarium and are very useful to be able to go after this very vexing disease.
Hey everyone, Ryan Rad here from neurosurgerytraining.org. If you like that video, subscribe and donate to keep our content available for medical students across the world.